Good morning. My name is Richard Altus. I'm the president of PDR Network. On behalf of PDR and all the speakers here today, we welcome you to PharmEHR 3.0. And I think as that video just demonstrates, there's a lot that has changed in information technology and healthcare information technology over the past decade. In fact, a lot has changed in the past 3 years since PDR has sponsored this summit. If you think about it, 3 years ago, less than 50% of all primary care physicians reported using an EHR. Now, according to Black Book research, 69% of all physician practices have completed some type of implementation. And that percentage grows to 83% if you look at practices greater than 10 doctors or more. And current trends in 2013 now include abandonment discussions of one EHR for another. So just in the last 3 years, a lot has changed. As we know, several years ago, the government started with physician bonuses for meaningful use of EHRs. Their thinking was that electronic health records can work wonders, but not by themselves. Just like buying an exercise machine, it won't burn off fat by itself. The benefits of putting an EHR in a doctor's office or hospital depend on how it was to be used. To encourage meaningful use of EHRs, the federal government decided to give bonus payments to doctors and hospitals that meaningfully use EHRs to improve the quality of care, reduce medical errors, and improve efficiency. By 2011, we saw professionals starting to prove meaningful use attestation, and the dollars began rolling out. In its December 2012 report, the CMS cited over 350,000 eligible professionals have registered for meaningful use attestation, and we expect that number of eligible professionals to grow in 2013. 3 years ago, e-prescribing was a fad. It was the hip way to send a script out to the drugstore. Now the prescription is at Walgreens waiting for you instead of you waiting for it. And most importantly, the letters EHR are no longer auto-corrected in Word or email to HER, as in the possessive pronoun belonging to her. We've come a long way in the last 3 years. Yet this conference is really about looking forward and not backwards. So what I'd like to do is spend the next 5 minutes or so talking about current trends in the electronic health record industry, and then how those trends will translate in today's summit. In February 22, 2013, Black Book Ratings published the EHR survey that said the market is expected to grow 21% in 2013, and as I just said, for the first time, there is a surge in current users who plan to shift systems to different EHR vendors. This adoption trend is further confirmed by a recent health technology CIO research study that stated that the adoption and meaningful use is the #1 priority for CIOs in 2013 for the second year in a row. Secondly, the development of interoperable EHR solutions is also a big focus among companies in the marketplace, hence the Commonwealth Alliance. However, there are really macro trends, and I want to get into what's more relevant to us here today, and it starts beyond just usability. Integrating EHR systems into the natural workflow will continue to be a problem to confront. EHR integrated usability has been on the radar of vendors in recent months. Integrated usability is defined as, is the system developing the requisite context-aware information the clinician needs at the point of care? And if it's not, what can be done about that? Patient-centered care in 2013 requires a patient-oriented workflow model defined as meaningful systems, boundaries, and implementations that are more consistent with cooperative work amongst healthcare professionals and their patients. Integrated solutions that draw providers, patients, and payers closer together to streamline accessibility to care is important in 2013. We know physicians make better treatment decisions and predictions based on better data, so we must get that information to the physicians and patients when they need it, and that's in the exam room. In fact, just yesterday, a survey published by Oliver Wyman stated that physicians say data from the pharmaceutical industry can help show value and ultimately lower costs. I'm sure those of you from the industry are glad to hear that today. Healthcare will happen without there being a physical encounter, and the EHR will have to cope with patient inputs a lot more. If you are a physician, expect to start getting requests from your patients to directly access and evaluate their medical records online. Remote patient monitoring and communications will become a focus point in 2013. With many healthcare organizations participating in or preparing to form accountable care organizations or other models of managed care, their success will be measured by their ability to reduce costs associated with readmissions and enable improved patient outcomes through preventive care. This translates to better communication with the patient outside the physician's office and by using the patient portal aspects of the EHR. So if I were to conclude the key trends for 2013, continued double-digit growth in the EHR market. In 2013, it will be all about workflow and surfacing or communicating to the physician the most appropriate data at the time of patient care. Usability now translates into both physician and patient usability. The EHRs and physicians must get comfortable with the patient now becoming part of the EHR communication value chain through the patient portal. So let me switch gears for a minute and talk about how these trends will be discussed and dissected at today's summit. After the opening session, you'll hear from experts representing the EHR vendors, and you'll better understand the changing environment in which healthcare is being delivered through the EHR and where the usability pain points are getting addressed. Late in the morning, we'll spend time discussing how effective communication can take place in the exam room to both physicians and patients, as we'll hear from a panel of pharmaceutical executives and where they perceive the opportunities and the challenges exist to communicate with both physicians and patients. After lunch, we'll get Wall Street's view of this high-growth market, as we'll hear from Sean Weiland, a senior research analyst at Piper Jaffray. As we figure out how best to communicate to physicians and patients, we need to manage the hurdles of the pharmaceutical industry, medical, legal, and regulatory challenges. It is a regulated industry. We will share with you best or current winning solutions. And then the balance of the afternoon will focus on insights as to what is the most effective and appropriate forms of physician and patient communication in the EHR. We'll kick off this afternoon session with how to message in the exam room. This session will be followed up with market research on what best practices look like. And towards the end of the day, we'll hear from the doctors themselves. We have 4 very active and vocal physicians joining us late in the day to share with you their realities and challenges in the exam room as they adopt, integrate, and utilize EHRs. And they promised me that they would not be shy. So with that, I'd like to kick off our first session this morning, which is entitled EHR Adoption, Workflow, and Meaningful Use, and will in fact be led by 2 physicians, Dr. Ed Foch and Dr. Doug Genteel. Dr. Edward Foch is the executive chairman of PDR Network and has been with PDR for the past 3.5 years. He has been the visionary leader of PDR as the company has transformed itself to be the most trusted aggregator and disseminator of healthcare information-related products and services delivered through multiple channels, including digital and EHR, for the pharmaceutical industry, physicians, and patients alike. Dr. Doug Genteel is the Chief Medical Officer of Allscripts Healthcare Solutions. In this capacity, he directs clinical product strategy for the $1.4 billion company. Dr. Doug Genteel continues to practice emergency medicine part-time at Fletcher Allen, the main teaching hospital of the University of Vermont College of Medicine.